MS is a condition that impacts about 400,000 people in the United States, and there are several forms of the disease. Here today to help educate us about a form called active secondary progressive multiple sclerosis and a new treatment option are Dr. Regina Berkovich and Paula, who's been living with both MS and SPMS for many years. Welcome.
Good morning.
Thank you.
Hello.
Dr. Berkovich, exactly what is SPMS with active disease?
It's one of the clinical forms of multiple sclerosis, secondary progressive MS. Relapsing remitting MS is the most common form, and 80% of that one may convert into SPMS. And active SPMS is that condition with superimposed inflammatory activity such as relapses or new or enlarged lesion formation on MRIs. So we are quite excited that there is a medication that got studied for that particular condition in the large clinical trial and has shown efficacy and got approved, and that medication is Mayzent. The reason of basically excitement is that many medications before were studied for it and did not show efficacy. Because secondary progressive MS is just such a challenging condition to treat. Yet Mayzent did show efficacy, and it was approved for different clinical types of MS, like early stage of it, relapsing remitting, and also active secondary progressive MS, which is what makes me professionally most excited, because those are the patients who are needing the treatment as soon as possible.
And what are some of the most common signs and symptoms?
Well, it's hallmark of it is accumulation of disability, really. So usually patients would not be able to maintain their full-time job, for example. So it could be as a result of the physical disability, such as inability to walk and move around and balance well, or visual deficit, blindness or partial blindness. Or it can be cognitive issues such as inability to focus, inability to memorize new stuff or learn new material, or it can be combination of any of those symptoms. And because it is so diverse and it can be presented in such different ways in different patients, it can be very challenging to diagnose. And now when all these symptoms do not seem to get any better ever. So there is no remission whatsoever, but continuous development of disability, continuous accumulation of the symptoms and limitations. That is the condition of secondary progressive MS.
Paula, you're living with SPMS. How were you diagnosed, and what is it like living with this disease?
Well, I was first diagnosed with relapsing remitting MS about 18 years ago. It was right after the birth of my fourth child. And then about 8 years in, I was talking, my doctor and I were talking about my symptoms, my disability. It was just accumulating. It was getting worse and not getting better. And we decided at that point, that it took about a year or two to finally put a diagnosis on it of SPMS, because it's not a quick and easy diagnosis to make. It's really just by observation, I think. And so for me, living with SPMS, it's always uncertain. MS, you never know what might be around the corner. But working with my doctors, finding a good treatment plan, I've been pretty stable for a while now, and I feel good about that. And I think that the future for me, it's always uncertain, but I think it might be okay at this point.
Well, how did you notice that your symptoms were progressing?
They just weren't getting better. I was having a harder and harder time getting around. For me, my main challenge is my mobility. So when it's harder for me to get up and walk, I use a walker at home. I use a wheelchair when I go places. I drive with hand controls. But when it's harder for me to get up from the table to the kitchen without losing my balance, or maybe I'm too weak, or that was how I noticed that things were progressing. It was just harder and harder to get around the house.
Dr. Berkovich, when someone has MS, are they typically finally attuned to their condition enough so that they would notice a major change, especially one that they should mention to their doctor?
There is certain shift of paradigm at this point, because we used to pay attention mostly to relapsing remitting MS because medications were approved for that one we knew how to treat, and less attention was given to the secondary progressive MS. That's why I'm really happy that some of the information is becoming more and more available about it, and people are asking all these questions. So raising awareness of secondary progressive MS is extremely important, because we would like to be able to slow down the progression. This is basically something that we now know that, for example, Mayzent can do, because it did show that effect in the large clinical study, and it's one of the indications it got approved for. So I would encourage people living with MS to pay attention how dynamic their symptoms are. Do they get better, or do they tend to stick, just not improve, get accumulated? And definitely share this concern with your treating urologist, and we would prefer if all MS patients would be seen by MS specialists, because the treatments are so many these days, definitely more than 15 of them, and decision making is a challenge. You need to be monitored by the regular MRIs. You need to be noticing the activity of the disease, which basically will be indication for treatments such as Mayzent.
So being aware of your body is really important if you have MS.
And getting some objective evidence from the MRIs as well.
And of course, then being honest and upfront with your doctor is key, even if you think it's minor, because it could be something significant.
Correct.
Paula, what would you say to MS patients about the importance of speaking to their doctor if new symptoms present?
Well, I think any MS patient needs to be seeing a neurologist who specializes in MS and talking to the doctor, tracking their symptoms, and if a doctor feels that this patient would be helped by any new medication that came out, then the doctor would certainly work with the patient on it. But patients need to be an advocate for themselves. They need to ask their doctor about what's out there, what could help me, is there anything new? They need to be telling their doctor about their symptoms, about how they're feeling. And together the doctor and the patient can figure out if there's anything else that would help the patient.
And Dr. Berkovich, how long would it take for a typical patient experiencing SPMS to find some sort of relief from the symptoms with this new treatment option?
Very individual. And again, we're talking about progressive disease. Every case is very different. So that's why I wouldn't be able to give you any prognosis, because it has to be considered in respect to the individual patient in individual situation. I can tell you that the study before the Mayzent got approved, the clinical trial took 2 years. It can vary from patient to patient. It doesn't have to be 2 years. It can be different. And then efficacy of it and the fact of the positive effect may not be so easy to trace for someone who is not a professional. So slowing down the progression is something that calls for realistic expectations.
And of course, always check with your healthcare provider. Where can we go for some more information, Dr. Berkovich?
There is a specific website, mayzent.com. All the information can be found there, and more information can be found on Novartis' website also.
Thank you. And Paula, thank you very much for coming on to share your story.
You're welcome.
I'll be right back.